Think about the word trauma for a second. There are some people that say we all have trauma. And then there's others that will say we're over traumatizing. We are saying that everyone has trauma, but there's really only a few people who have severe trauma, right? What if both is true? I can tell you the story of my trauma. I refused to admit that I had trauma even after losing 3 children. It wasn't until 9 months after my third child died, and I went for a brain scan. And the result of the brain scan basically said your amygdala is on fire. And your amygdala is the fear center of the brain, and this is where PTSD impacts your brain, right? And it wasn't until I had that objective knowledge that I was able to submit to actually having trauma. So why was I so resistant? I think we often think about mental strength as pushing through and not having the environment impact you, right? And we hear people talking about grit and resilience, and you wouldn't have PTSD if you had these things, these characteristics. We don't teach it anywhere. We just say it's like you either have it or you don't. But what I have learned in my own story and treating other people, my name's Dr. B. I'm a psychiatric nurse practitioner with over 20 years of clinical experience and personal trauma. And what I have learned is that oftentimes the people that we think are resilient and pushing through and grit are doing just that. They're pushing through. And I had gotten to a point after losing my third child, because it wasn't all in a row. It was a drowning accident, medical, and then my third child, Maya, dying in her sleep. And I was pushing through. I was like, this is grief. And I became a grief expert, and I teach on grief and how do you feel the pain of grief. But losing a child is trauma. And there's many things that are trauma that we don't identify as trauma. So what is trauma? We know that physical, sexual, emotional abuse, we talk about that as trauma. We talk about, military people who have gone to war and seen people murdered, firefighters, police officers may have experienced trauma, right? But what about the people, the psychologists, the mental health space that says everyone has trauma? Well, I was in this space where I was like, we can't say everyone has trauma, right? Because it maybe weakens the story of people who have gone through significant trauma, right? And that's the narrative that I was telling myself. I remember I worked in a juvenile prison right out of nursing school, and I was the director of nursing. And one of the things that we often said to these juveniles who were in prison for some sort of crime, and they would be telling us their stories, we'd say, don't victim stance, don't victim stance. And I went through life with that same mentality. I'm not going to victim stance. But the reality is just like those young boys in that juvenile prison, their story, their trauma, the neighborhoods they grew up in, the neglect and abuse they experienced did impact their choices that got them into prison. It wasn't just a victim stance. It's basic human psychology, right? And so when we talk about trauma, maybe we should change the word, because trauma does seem big and scary and impactful. We all have injury. We all have things in our life that change the way we perceive the world. It changed how we show up in the world and likely changed our decisions. And, going back to that story of the juveniles in prison, our intent was good in saying victim stance, don't victim stance, because, there are stories of people who have had that kind of trauma and they make good choices, right? And so making that shift that behaviors and choices, the choices that you make are your decision, but knowing how your trauma or injury impacts those decisions helps you in the insight of those decisions. Does that make sense? So, me refusing to say I have trauma and then getting to this aha moment, which is in the documentary, by the way, this aha moment of, oh my God, I have trauma. The problem with that was twofold. It was good and bad, right? The good is that I now have insight on how to be better, how to start working on my trauma. The bad part was now it's brought to the surface and there's symptoms of the trauma, right? And so I think sometimes people are scared to identify trauma because they've put it in a nice little box and they're scared if they open that box, it's going to be messy and it's going to be difficult. So there's a lot of research on trauma. And it talks about like the trauma is held in the body. And we know this from Eastern medicine and different energy works. But even in Western science, we know that the body is holding on to these traumas, that our mental health, the things that we have experienced in life, if we are not processing them and releasing them, they are impacting us physically. And, maybe it's just a little stomach ache, or maybe it's an autoimmune disease, right? Like to what point is the body holding on to this trauma? So think about in your life, what is your trauma? Maybe you have very known trauma. Maybe, you've lost a child and you've thought about, losing a child being trauma for the first time. Losing a child is definitely trauma. But I can give you another example of something that I did not identify as trauma. My biological father died when I was 10 months old. And, it had been suggested that maybe that's trauma or, you need to work through that grief. And I'm like, I didn't know the man. Like I did not, how can I grieve someone I did not know, right? I was 10 months old. But let's go back to that 10-month-old brain. Here I had two loving parents that lived together and that were happy and were sharing time and cuddling and love with me. And then, bam, one day he just doesn't come home. Now, okay, now that, half of the love, right? Like this one person is gone. But then my mother's emotional connection was impacted, right? She just lost her husband. And so even though I was 10 months old, don't remember any of this, I have to acknowledge that had an impact. That was an injury on how I perceive the world, right? 1 minute you can have love and support and care, and then it could be gone. That changes your perception of the world. So when we think about trauma, let's think about, what are the things in our life that change the way we perceive the world? And, and these are usually to a negative, right? Grew up without a father until my mom remarried. Like there's these consequences of this trauma that I didn't even think about, obviously, because as a child, you don't have that cognitive ability to abstract think through those processes. But that is an example of injury that changes you. So I want you to think about, what are the injuries in your life? What are the things that have happened that had a negative impact on you and you're just trying to push through? So we know from clinical research, the treatment, what we should do with our trauma is release it. And there are professional ways to do that, EMDR, brain spotting, different types of talk therapy to release some of that trauma, right? But if we all have trauma, we can't all go to a counselor, or maybe you don't want to go to a counselor, right? How do you release your trauma? Well, first, and I teach the Mentally Strong Method. I want you to click the link below. You can get the worksheet, the Think, Organize, Choose worksheet. The reason I want you to click it is because it has the list of the 10 categories. Because the Mentally Strong Method can be summarized in 3 words: think, organize, choose. So can you think through your problems? Can you organize them? And can you make choices in line with what you want? So it's not just thinking through your problems, it's thinking through the impact of all the things that have happened in your life, how those are impacting your current problems. So if you look at that worksheet, it has grief and trauma are separate, and negative self-talk, spiritual anxiety, behaviors and choices. There's different categories. But let's first list your trauma. And as you list your trauma or injury, maybe you don't have, or you don't like the word trauma, or you don't have what we call big T trauma, right? I want you to list the events in your life that change the way you perceive the world. And then I want you to look at those other categories and think about how that trauma has impacted those other categories, right? And so if you think about me losing my children, right? Obviously grief, obviously trauma. But for me, in losing my children, it was a huge spiritual conflict, right? Like, I believe in a God that loves you and protects you. And if you pray, that positive things would happen. And that did not happen for me. And so that created a huge spiritual conflict. That's not my grief. That is a whole different story. And so when you think about these events in your life, I want you to think about these other categories and how it impacted that. If you think about, losing my father at 10 months old, it's definitely trauma. It changed the way I perceive the world. Not really grief, because I don't feel like I had a person to grieve. But let me rephrase that. I grieve that I didn't have a father figure present. And it also impacted my negative thoughts. Your negative thoughts started before age 7. And there's all kinds of research to support that. And so, not having a father that loves me and shows me my worth impacted, my negative dialogue, right? And so when you look at your trauma, look at those other categories. How did it impact those other categories? Because when I teach, you've got to release the trauma. Yes, we've got to release the trauma, but we got to do different things with our anxiety, our spiritual conflict, our grief, right? So yes, we need to learn to release our trauma, but we also need to organize it first and see the other impacts. And then we make choices for those things as well, right? So how do you actually release trauma? Well, you decide that you're going to do it, right? And believe that you can do it. You may seek, like practitioners that understand how to release trauma. That could be professionals, mental health professionals. It could be energy practitioners. It could be an acupuncturist who understands, where these things are being held in the body and releasing them. Massage therapists with some extra training, know how to kind of help move things through the body. But the most important thing is that you know and believe, and that you are visualizing this release of the trauma. Now, that doesn't mean it's going to take away the pain of the grief. It does not. It doesn't mean that it's going to fix your spiritual conflict. And this is one of my pet peeves, at people who are struggling and they've experienced trauma. They often walk away from their spiritual health. So many of my patients have come to me and said, when I was being molested, or when I was being raped, when this was happening, I was praying to God to protect me, and there was no protection. That is a spiritual conflict. And so their compensation was, well, there is no God. And I don't care if you want to use the word God or not use the word God, but we are physical, mental, emotional, and spiritual beings. And taking care of our spiritual health impacts our mental health. And so in the Mentally Strong Method, I always encourage everyone to address spiritual conflict. I'm not telling you to believe a specific thing. I am asking you to dig deep and look under that trauma to see if you can connect with your soul, your spiritual self, and begin to nourish that part of you. Because trauma, and especially trauma of that kind of traumatic grief, is going to cause a spiritual conflict. It did for me, and it does for so many people that I talk to. So, in the Mentally Strong Method, we are learning how to think through whatever's going on in our brain, right? And this video is about trauma. So how has that trauma impacted you? Oftentimes when people come to me, there's old trauma and they're coming and they're saying, I'm depressed, fix my depression. And yes, it can lead all of these things, right? The grief, the trauma, the negative self-talk, the spiritual conflict can all result in depression. But depression can also be a chemical problem, right? And it often takes years to unravel what has caused someone to feel depressed. So sometimes it's appropriate to take medication or do something clinically to treat the depression while we figure out how we got to this place. Okay. And so it is not an easy step. I wish I could say, just release your trauma. It has been 4 years since Maya's death. And so 3 years of me actively trying to release trauma, separate it from my grief, and, acknowledge the pain of my grief while I'm working through and releasing that trauma. And I had a PTSD symptom yesterday. Okay. They don't happen often, but I had one yesterday, right? So be gracious with yourself. This is a journey. This is not a quick fix. And if we just say, well, I can't open that trauma box right now, that could be true. I talk to a lot of people. They're in the midst of raising their family. They're, struggling to just survive. That may be true, but don't put it off forever. Think about a teapot or a soda can, something that has like pressure in it. And if you just keep shaking it or boiling the water and holding down the lid, it will explode. But if you let a little bit out at a time, the water could just boil. The soda won't, blow up everywhere. So taking care of yourself and understanding that this is a journey, and I'm sorry that you have experienced trauma, but it is a gift to learn to process it and release it. So you are mentally strong. Continue watching the videos that we have here. Subscribe to the channel. Make sure you get that Think, Organize, and Choose. That'll also invite you into our, email newsletters to really learn all the things that we're doing to try to help people work through their trauma. You are mentally strong.